Welcome to Win Wednesdays. This is our inaugural session as an initiative of Women in Industry, presented by the Roland School of Business at Point Park University. Our Women in Industry initiative is really about engaging and empowering and educating, accelerating the success of women identified students and professionals, and engaging leaders affecting conversations and encouraging allyship through elevating experiences. We do have several initiatives under this umbrella of WIN, or Women in Industry. One is, of course, the Win Wednesdays virtual speaker series. We also have a WIN campus speaker series, and when the environment changes, that will probably ramp back up. We also last year initiated an Accelerating Women in Industry event aligned with International Women's Day. So look for that coming again in March of 2021. And you're also welcome to support our programming. You can find more information about WIN through Point Park University Women in Industry. And we'll have some information for you at the end of our session today. I'm Doreen Saletti. I'm an associate professor of marketing and sales and program coordinator. I'm also co-hosting our Win Wednesday series along with my colleague, Sandy Marvash. Sandy is an assistant professor of human resources, program director as well, and she is also director of our Women in Industry program. So I'm going to turn it over to Sandy so she can get us started today.
Thank you, Doreen. It is with great pleasure today that I introduce to you our inaugural speaker, Marianna Stoneburner. Marianna is the Chief Nursing Officer and Vice President of Patient Care Services for UPMC Horizon and UPMC Jameson. She joined UPMC in 1993 and has 27 years of progressive nursing leadership experience in both academic, community, and rural acute care organizations. She serves as the nurse executive with the authority and responsibility for establishing standards of nursing practice. Her functions include driving, supporting, and modeling a caring, service-oriented professional culture focused on employee engagement, quality, patient safety, service excellence, fiscal responsibility, and the overall patient experience. She is a member of the executive leadership team, building and supporting effective collegial relationships with internal and external stakeholders and ensuring optimal operating efficiencies and strategic planning. Marianna holds a master's in nursing from Waynesburg University and bachelor's in science in nursing and education from Duquesne University. Marianna lives in Pittsburgh with her husband of 30 years and has two wonderful grown children. Marianna, thank you very much for joining us today, and we're really excited to hear what you have to share with us.
Thanks, Sandy and Doreen. I really appreciate the opportunity to be here today on this inaugural program to talk a little bit about my experience as a leader during this uncharted time of a pandemic. As Sandy mentioned, I am the Chief Nursing Officer of UPMC Jameson and UPMC Horizon, and just to orient you a little bit, my three hospitals, the hospitals are made of 3 campuses spanning Lawrence and Mercer County. And so my facilities are about 20 minutes apart, but spanning about an hour and 15 to get between the 3 of them. And so this has been certainly an experience like any other time in leadership that I've had. As Sandy said, I have actually been in executive leadership since 2010. And I have to say that this experience of being a leader during a pandemic has really solidified the things that I know to be true, and also taught me some things that in the future that we would need to employ. So Doreen, if you could advance for me. The world changed completely on March 11th for all of us in the world. Even though we were watching what was happening globally in December, January, in February, we started to really understand as the events started to unfold in the state of Washington, that it wasn't a matter of if we were going to see the coronavirus. We actually knew that we would, but it was really a matter of when. March 11th, the World Health Organization declared COVID-19 as a pandemic. That was probably one of the most important days that I've ever had as a leader. A pandemic, just the word in and of itself, just leads to so many connotations. You think about, when people think about pandemic, they think about the Black Plague, the Spanish flu, the swine flu. We haven't seen a pandemic like this in my lifetime. You can go ahead and advance the slide. And just to give a global picture, I actually abstracted this from the World Health Organization website on September 9th. This is already old data, but it just gives you a global picture that today the coronavirus is spanning 216 countries. We have not seen anything like this. I remember my infection prevention manager coming into my office the morning of March 11th, and she said, Marianna, the World Health Organization just declared this as a pandemic. Do you know what that means? And the reality is I really didn't know what that meant. I knew that that we had known it and the way that we were operating was going to change, but I actually didn't understand the gravity to which we were going to be affected, both personally and professionally. If you could go ahead and advance the slide. You know, when you hear the word pandemic, like I said before, it immediately gives you a very visceral reaction. What does that actually mean? And although we knew from what we were seeing in China, what we were seeing in Italy, and as it was unfolding in Washington State, which was really the first part of the United States in which we understood the dramatic effect that this pandemic could have on any region, that we started to think about what would this really look like for us. Certainly we didn't wait until March 11th to think about planning this, but when I talk about the crisis phase of what this was, on March 11th, for the people that worked with me and for me, the word pandemic and what people were seeing in the media was affecting everything about the way we were doing business. And really to talk through what it was like during that initial phase, which I called the crisis phase, and really you can apply this to anything that is a dramatic change in your organization. There were really three critical components of what needed to happen in the immediacy of what we were seeing. The first was really about making sure that we were creating order. When they declared that it was a pandemic, the first thing that everybody in our organization started to think about, well, what does that mean for me? I think everybody felt like that. What does that mean for me? What will that mean for me professionally? How will that change work? People were panicked. And the reason that my people were panicked was they knew there wasn't going to be an option not to work in the environment. They knew that they were going to have to work in a situation, and when they were confronted face to face with the virus, they were watching around the world that was infecting and in fact killing people. It was really important. You know, I'm a scientist by trade. Everything that we do is based on evidence, a lot of planning, a lot of research. And the reality is we didn't have time to see how it was going to unfold. So this went against everything that I know that we do. We like to sit back. We want to wait to see how things are coming. We couldn't in this instance. We really had to act with urgency and be decisive about what we were doing, knowing that some of the decisions that we were going to make weren't going to be the right ones. At the same time, we really had to start to think about how was this going to impact the operations of our organization. If you even turned on the news, you saw what was happening in New York and the sense of panic. You heard there were no ventilators. They didn't have places to place patients. They didn't have enough staff. They didn't have enough equipment. One of the key pieces of what we needed to do was really look at how were we going to sustain ourselves in our organizations to be able to manage what we were predicting we may see. So I'm assuming that most people prior to March 11th really didn't even know what an N95 mask was. I'm now thinking that everybody knows what an N95 mask was. But this was a reality of something that we had to take very seriously. Were we going to have enough supplies, and how are we going to be able to give our staff the resources? I'm very fortunate. I work for the University of Pittsburgh Medical Center, which spans 40 hospitals throughout the state and into Western Maryland and New York. We were able to leverage ourselves as an organization to be able to get supplies that we needed. Space was the other thing we needed to think about. How are we going to manage patients that may potentially be coming into our buildings? Also, how are we going to take care of them? I wish I could produce nurses at the rate that we need them, and the reality is that it's a finite resource, and had to start thinking about, if we really got into this space, how are we going to manage that? could not, we had to look at what was the financial impact. The reality is that, you know, we're an organization that does need to make money for us to be able to sustain ourselves. What was going to be the short-term impact to our finances? And then what did we think in long-term, what that was going to affect for us? And then starting to think about the communication. How are we going to communicate with our staff all of the time? And these weren't things that we did in order. These were things that we were doing at the same time. I didn't do these things by myself either. I really had to rely on a very close team to help me really put plans in place. One of the things that I learned very quickly is that even the disaster plans that we had in place were not adequate for what we were foreseeing to be part of our future. The third was really understanding how was this going to impact the people who were leading and the people who were really on the front line, both personally and professionally. So in a nutshell, all three of those things were things we had to do immediately, had to refine as we went along, but really had to pay attention to. Next slide for me, Jane, please. The front line. This picture, to me, tells a story about what life has been like for us for the last 6 months. This is a picture of my ICU nurses, and the woman in the yellow is the ICU director. They had been in, this was the first COVID patient that we had received. We actually, unfortunately, received the entire family, mom, dad, and their daughter. And they had been in this room about 6 hours with this patient, trying to get people rotating in and out so they could, you know, get some water, get some food. And the secretary wrote on a whiteboard, "It's a beautiful day to save lives," and put it right up above the window in their unit and took a picture of it and sent it to me. I just got such an emotional reaction to this because this was the people who were in the trenches of what we were doing every day. And if you turned on the news, you saw pictures like this everywhere. It was the people part of managing through this pandemic. You can never underestimate the effect that this had on them. We really had to think about what structures did we have in place to support the staff. And in a healthcare organization, because we always deal with the unknown, we do ask our employees, make sure you have emergency plans. What will happen during a plane crash if you can't leave work? What happens if you have a fire, which actually happened to me previously? What will happen if you need to evacuate? How will your children be taken care of? What about your pets? Things like that. We actually asked them to put it to paper. The other thing that was important during this crisis time is we had to listen to their concerns. Every one of the people who's standing in those rooms are moms, their wives, their sisters, their daughters, brothers. They have families. They knew that they were working in a room with a COVID positive patient and had no idea what that meant for them when they left that day. It was important and up to me to make sure that I was listening to them. They cannot separate who they are when they come into the door every day. They bring their whole selves to work. We say to people, well, leave it on the doorstep. The reality is they can't. And it was important for us to listen to them. Emotional intelligence. This is where, as a leader, it's very important to understand where people are at that time. It was also very interesting to me to see the people that I thought were going to be rocks. They were going to be the people that were going to help me through it. And very interesting, they were the people who were falling apart. And it was really important to step back and say, okay, this is where this person is. I'm used to this person being really solid, but today I need to understand where are they coming from, what's driving this reaction, and how do I help them move through it. Be direct with in addressing their concerns and fears. You know, it was important that we say you don't have anything to worry about. The reality is they did have something to worry about. We just weren't sure what that was yet. We call it in healthcare the second victim syndrome. While you're dealing with the immediate crisis, when things happen afterwards, for example, unfortunately, we lost both the husband and wife in this situation, but we were able to save the daughter. The staff, though they did their best, really were experiencing that second victim syndrome. Did we do everything that we could? They really took it hard. We really had to support them. You have to manage your emotions as a leader. There were many times during this pandemic that I would have really liked to stand in the middle of a department and scream. Obviously, that would not have gone on over well. People were upset. People were, being emotional to me. They were being reactive at me. It was very important to take a pause and manage how I was feeling myself. Know that you will make mistakes. We made plenty of them. I made plenty of them. You need to own them and not blame other people for them. You just need to know when you're talking with the staff, you just have to own what happened. I'm a human being. I have been saying to people, I've never led anybody through a pandemic. I certainly didn't get it all right, but I did learn a lot along the way. Go ahead, Dorian, advance this slide, please. So I mentioned developing a communication plan as part of the crisis phase. I can't stress how important this was. It is important as a leadership team. We actually had a command center. We actually had a room at each of our campuses in which our leadership team would gather and really talk about all of those operational components, the staff component, but this is really where we talked about how are we going to communicate? Who, what, when, where, and how often were we going to be communicating with the staff? We had to figure out all the platforms that we needed to do. During the pandemic and today, we actually communicate with our entire department level supervisors at 7 a.m. and at 2 p.m. every single day. What we do in the heart of the pandemic, all of our medical staff were invited to this. And this was the one avenue in which we were really able to see how many patients were we caring for. What was our supply of N95 masks? What did we need to do with updated PPE? As the CDC was changing and as we were learning about the virus, things changed every single day. One day we were wearing N95s for everybody. The next day we were not wearing N95s for everybody. We were switching our protective equipment. How do we get that message to everybody and why? All I can say is when you think you have communicated enough, continue to communicate. I would have people say, well, I didn't hear about that. And I could think to myself, I've said this 500 times. Everybody should have heard about it by now. What I realized was we had to start to assessing how was that communication being cascaded through the organization. And so for perspective, it's myself as the chief nursing officer, the president and the CEO, and the vice president of operations. We were the 3 senior leaders between 3 campuses. How were we going to make sure that the environmental service worker heard the same information that the director heard? And so we started to do was rounds. I would go to people and say, today we talked about X, Y, and Z. Can you tell me what you know about it? I was happy in most instances. People would say, yes, in our staff meetings today, they gave us this information. So we said to all of our leaders, you have to have daily huddles, how often you have them, when you're having them. And again, I'm a 24-hour operation. So communication and leadership can't happen just, normal business hours. We need to think, how are we going to do this for everybody who's here who only works at night? So we had to make rounding schedules. So it was very complicated for us to do this. Communicating with transparency. People want to know the truth. People also know when you're not communicating transparently. They know it. You have to be honest. You have to be accurate with what you know. And you have to be humanly. You can't be a robot. These are people's lives. The important information that we were presenting to them was going to affect whether or not some of them could even go home at the end of their shift. And how would that affect them? You had to be empathetic. You had to present reality. Offer them hope, though. I could not stand in a room and say, this is doom and gloom, and good luck. You had to say, we're going to get through this. We have enough equipment. And the things that will come through that are barriers, we will figure them out. I might not know the answer this minute, but we'll figure it out together. You have to offer them that hope. Don't underestimate the value of your presence. Visibility during times of crisis are the most important. They didn't want to know that Marianna was sitting in a command center in an office. I actually had a staff member say to me, I heard you were in the command center, that you're always in the command center. So I thought to myself, well, why don't we invite people to the command center? Because it's this like mysterious place. The reality was it was our executive conference room. It wasn't anything that fancy. The only thing different about it was we were all in one room. We had a couple of whiteboards and we had the news on. So all of a sudden I see a line of people who wanted to come in and see where this command center was. So what I started to do was take my smartphone, go out and about, and I learned how to self-video, which, that's technology at its finest. And I would videotape myself in different parts of the hospital, talking to different people. And then we would post it on our internal social media platform. People wanted to see me. They didn't care how they saw me. They just wanted to know that we were there. And rounding between 3 campuses was very challenging. And again, 24 hours a day, how are we going to do this? You want to go ahead and advance the slide. This is just some examples that I thought I'd throw up here for you, is that we used a variety of means to communicate. Certainly, in-person communication and virtual communication is the best, but we knew that we had to have alternatives for staff to be able to do this. The one size doesn't fit all. I work in an industry that predominantly has 4 generations of people working. So you can't use social media for everything, because my employees that are working, that have been there for 40 plus years, they're not on social media. They actually don't communicate that way. And then looking again at the generational differences, some of my younger folks just wanted it to the point. Some of my more experienced individuals really wanted the detail. So really morphing what we were talking about to make sure that we were fitting all of this. And then it had to be easily accessible. I gave feedback all the time to our corporate team. If I'm the chief nurse and I can't find the information, how is my EVS worker going to find the information? I need to be able to click on it once and it open it up and give me all of the things that I need. I don't want to go to 10 different places. The other thing you'll see on the right is we actually had links for mental health, parenting resources, work arrangements. Again, you cannot ignore how this pandemic was going to affect people. So what was it like getting our first patient? Everybody was waiting. Like, what was it really like? I happened to be the person on call the night that we got our first patient. And of course, it was going to be at 2 o'clock in the morning. So I had to drive an hour and 15 minutes into my emergency room. And to be honest, when I walked in the door, you could see the panic on everybody's face. And then what were we going to do? We walked through our process. Like, I got to see, well, how the process worked. What did it look like for them? I was able to say, you know what, this isn't going to work. We need to regroup in the morning. Here's a gap, here's a gap, here's a gap. And then what I did is I walked around every department and said, we are getting our first COVID positive admission. And there was, again, when I say that you have to really calm people, people were fearful. People were fearful. And my presence there actually helped them talking through it. What were we going to do? Was a really important component of this. This communication piece is imperative. We actually have at the bottom, you see Access COVID-19 information. That is available to every UPMC employee. They can click on that. They can see anything that they want. What they need to do if they're worried that they might have been exposed. What will we do if they are exposed? What are their benefits? Anything that they want to know, they can go into that site. You can go ahead, Doreen, and go through that. Here's the other thing, organizational flexibility. Everybody ever look at their job description and this little tiny line, there's this little tiny line on mine. My job description is like 5 pages long, and at the very end, there is, and it's in quotes, and it says, other duties as assigned. It never became as real as it has during this pandemic. Everybody got other duties as assigned, and that is an important component of leading through crisis, leading through major change, especially in this pandemic, is we had to become very nimble. I think most of us in any of our industries sort of, put ourselves in little boxes. This is what I do every day. This is what I come in, and this is my role. This is my world, and this is what I can do. Well, that wasn't the case now. I was having to, at one point during this pandemic, I had 50 registered nurses who were quarantined. So if you think about what that meant for me and an operational perspective, I did not have enough nurses in my organizations to actually take care of the patients who were there. So remember, while we're having this pandemic, we still have everybody else who's sick. People didn't stop getting sick during the pandemic. What really happened was the sickest of the sick patients came into our organization. Those patients that were really had to be there. Even though we stopped doing quote unquote elective surgery, elective only means scheduled. It doesn't mean that it's not necessary. So somebody who has a cancer diagnosis who needs to have a tumor removed, is that an elective surgery? Technically, it is. However, if we don't do the surgery, the life expectancy of that patient isn't there. And so we still had to operate a hospital in the middle of this pandemic. So I had to start asking people to work outside of their comfort zone. So asking nurses who normally work in certain departments that were really almost closed because we didn't have the volume, to say, I actually need you to go work in the intensive care unit. Because now I'm asking the intensive care unit to take care of patients they have never had to take care of ever in their whole career. We also had to learn how to do things remotely. So for example, in that ICU, we had a virtual ICU education group that sat in a war room to talk through in my patients' rooms. This is how you need to manage this patient. We're going to teach you this skill virtually, and you're going to do it right there with that patient. And we're going to be on the computer screen while you're doing it. It was like operating in a surreal environment. We asked people to do things that they had never done. We also asked people to stay at home. Many of you are working from home. What was that going to be like? How are we going to do that? We never thought about that. How do we have people in healthcare who might work at home? Well, our financial team didn't need to be in the hospital, and there were a lot of people who could do things at home, but the majority of our workforce really had to be on campus. We asked people to take on alternate roles. I came in one day and said to my CEO, I actually need you to be a screener today. We screen every patient that comes in. We screen every employee that comes in. That takes manpower. We didn't get extra staff to do it. We had to figure out how are we going to incorporate this to the work. And I said to him, I actually need you for 8-hour shift on Saturday. He said, okay. So this isn't when you say, okay, I'm in this role and I'm not going to do anything. This is where we said, this is those other duties as assigned. And we really had to do that. We had no choice. Working at one point during the pandemic, we lost every employee in our outpatient lab from exposure. We lost all but 2 of our respiratory therapists at UPMC Jameson from an exposure. So we were having work staff shortages because of the pandemic, and how were we going to function in it? So organizational flexibility was the key. I will also say we're not going to go back. We've now learned that we can do that we can change ourselves into who we need to be to meet the needs of the moment. And that has really taught us a lot. What was important about asking people to do that was the why. Well, why do I have to do that? Why do I have to go there? And we had to really talk about the why. The why is so important. You can't say, Sandy, I want you to go ahead today and I want you to be a screener, and not tell her why. Well, the reason why is that it's so important for you to screen appropriately so that you're not letting any patients or staff come in who potentially were exposed or are sick to infect other people. The screener role is one of the most important roles we have today. And tying that why back to the mission and vision of our organization was the key. If you come into our organization, you say to my environmental service employee, well, what do you do here? Their answer isn't going to be, I clean. They do. Their answer is that I'm really important because I help prevent infection in my hospital. Because actually that's their role. We've tied it back to the mission and the vision, which is to protect our patients. And every time we ask somebody to do that, we tied it back to that. Staff got very good at saying, okay, you're right. All right, today I know I'm not going to do something. I'm going to ask you to work a shift you've never worked before. I had people working on night shift who were traditionally daylight people. So this was an important part of what we did. Go ahead, you can advance the slide. So along the way, there was a lot of things that we couldn't have prepared for. Very fortunately for us, we did not see the same spike that we saw in New York. We prepared for that in case it happened. And the thing that we did that I thought was really good that came out of this is that we really solidified those plans if we were to ever get into any other situation outside of a pandemic. If there was a disaster somewhere in our area, we now know that we have the ability to be able to manage through that situation and actually deploy resources where we need to. And it's not new. So people will already know they'll be asked to step into roles that they might not do this. But, people say, well, this is, post-COVID. My world will never be post-COVID. I will have COVID. It is now part of what we do. We have actually changed the way we operate our organizations so that we work with COVID now. It's not causing us to be like, what do we do differently? We've incorporated those workflows into the everyday world because now we're bringing our patients back into the organizations for those elective surgeries. But it was important to understand, how did we do? Like, how did I do? I've never led through a pandemic. I did the best that I could. I wasn't always sure what to do. None of us were. So it was really important for us to understand from our staff's perspective, well, what was it like for them? What are the things we did well? What were the things we didn't do well? So we decided we were going to ask the question. Every year we do an employee engagement survey. And of course, when was the survey due? It was actually due in August. And we all thought to ourselves as we were sitting at our executive management groups and saying, should we actually do the survey? Because we were concerned that it would really negatively impact our engagement scores. And full transparency, all of us as executive leaders, there's a portion of our pay that gets tied to whether those results were. And I think we all agreed that notwithstanding, we as leaders owed it to our staff to understand what could we have done differently. And so we decided to go forward with the survey. And so in August of 2020, we call it our My Voice survey. It's an engagement survey open to every employee, including myself, in the organization. This is throughout the University of Pittsburgh Medical Center. Every employee gets this. We actually surpassed our participation rates this year. We had 94% participation at our Jameson campus and 91% participation at our Horizon campus. So we knew that the data that we were going to get was going to be rich. We also incorporated into this survey specific questions about processes, communication, and leadership directly related to COVID. And what we saw was we actually had an overall improvement in both of the organization and engagement of 5%, which statistically is significant. Leadership did score favorability. There were certainly a lot of opportunities around communication, supply, and resources. We had about 1,500 or so comments. And if you think about all of these questions, we actually sat down and read through them. It was interesting to hear their perspective regarding some of the ways in which we communicated. I had one comment that was really tough for me. If you want to go ahead and advance the slide. Thank you. Which was one day I was doing what we called senior leader rounds in my surgical services department at my Horizon Hospital. And this is before universal masking in the hospitals was actually being implemented. And one of the staff asked me, Marianna, why can't we wear a mask in the hospital setting? And I essentially regurgitated what we had been told by our lead infection prevention physician and said, these were the reasons today we are not doing that. And 3 days later, they came out and said, we're going to universally mask. So how do you think that actually made that employee feel about my communication? It was about a paragraph long about how she thought I stood in their department and lied to them, that I was not being honest about masking, and that she felt that she lost trust in me because of that. Now, I could, it was, difficult to read, and there were those comments in there because as we learned about the virus, what we were doing to prevent exposure and spread changed almost daily. And that was really, really hard. What's important about the lessons we learned was that our messages, though, had to be consistent. And so from the top of UPMC to where we were at the business unit level, everything needed to be aligned. And we had to make sure that we were not saying something different than another hospital because, wow, do you know that this hospital's doing this and this hospital's doing that? Because they were calling each other. They were calling their colleagues who were working at UPMC Pasadena, or they were calling them at Northwest. Hey, are you guys doing this? Hey, are you guys doing that? Imagine if we were telling them something differently. Acknowledge the missteps. I actually went back into that department and said, you know what, I read some of the comments, you know, you're right. I mean, these were things, although I didn't lie to you at the time, I can see why it felt like that. You just got to correct and move on. Nothing went exactly as planned. And you have to be able to redirect very quickly. Things change sometimes minute to minute. And you had to be able to really think on your feet and redirect and change directions very quickly. You have to know that people will falter. Some of my colleagues were faltering around me, not really knowing what to do. These are people in executive positions, and understanding that, you know, I'm the captain of the ship. I actually could not falter. I actually had a very small, close group of other chief nursing officers in which we texted each other throughout the day. Today I'm struggling. I struggled. I mean, we all struggle. I have a family. I have a daughter who lives in Colorado. I was very worried about her. What was this going to mean for her? How was I going to be there for her if she needed something? I couldn't fly out there because I wasn't going to get on a plane, and I had to be here. We all need that support, and we're not all perfect, but employees will look to their leaders for every action and reaction. If I'm the captain of the ship and I fall apart, what do you think will happen to all the people around me? It's not that I had every answer. It's not that I knew everything that I was doing. I did not. It's not that I wasn't anxious or I wasn't nervous. When I was, missing all of those nurses, they looked at me and said, "What are we going to do?" And I had to look back at them and say, "I don't know right at this moment. I need a couple of minutes to think about it, but I don't know right this minute." But inside of myself, I thought to myself, well, what am I going to do? I have no idea what I'm going to do. I have no idea how I'm going to get out of this, right? And that panic was real for me as well. My mind is smart, but I am much better when I have a group of people with me. So more minds are always better than one. Go to your front line. Your front line is working. They know, they're working in it. They have ideas. Don't discount them. They're the ones who really were helping me through process, flow. You didn't think of this, Marianna. We need to think of this. They would call me, "Hey, Marianna, we're in this situation. Just so that you know, I don't think this is going to work. We think we could do this." Give them the autonomy and the authority to be able to do that. And at the end of all of it, the only thing you really can control is you. That's it. I had a very wise person tell me one time, the circle is small. Everything else you can influence. The only thing that you can actually control is yourself, your actions, and your reactions. And this was never more true than this whole time. And even today, as we continue, we don't have the anxiety anymore. People are moving through this. They know they can work safely, but you really can't control everything. And that's an important lesson in all of this. It will unfold as it is. Control and manage your own emotions and help your people through this. I said to my CEO, I feel like I should put a couch in all 3 of my offices now because I did a lot of therapy in the last 6 months. I feel like, I should now have a license to be a therapist. I'm in no way qualified, trust me. But there was a lot of that went on. Don't underestimate. People need to be able to talk to you as a leader. They have to be able to talk about what they're concerned about and not feel like they're being judged, or that their work is being judged, or in fact, their leadership is being judged. You want people to talk about it. It makes them better leaders. You can advance the slide, Jane. And so that is, my prepared talk. I am happy to take any questions that I might not have covered. And I know I didn't cover everything that happened in the last 6 months, but these were the highlights of it.
Oh, that's great. And Marianna, we've already gotten a number of questions that have come in. So maybe you could talk to us a little bit about how you created an environment that allowed for mistakes. You mentioned that there were mistakes that were made. There are things that you wish you could have done a little differently or a little better. But how do you create that environment that allows for mistakes or adjustments in especially amid this time of uncertainty?
Again, I think that it goes back to the organizational culture as a whole. And I think, it's actually working and developing a culture in your organization that recognizes that people are human beings and that people will make mistakes. And you do have to make it a safe place to do that. My leadership style and how I do and talk and lead even my frontline staff and my unit level leaders is that we should never be held back by worrying about failing. The failure that any leader has is in the not trying. If you think about science, how many mistakes were made in research along the way until we got one vaccine? The first try and the things that you do might not always be the right thing to do. You acknowledge it, you learn from it, and you move on from it. And that's really what, as a leader, that is the culture that I have really instilled in my team. And I have a large group of individuals that report to me. And it's important to create that culture as the leader. It starts with the leader. If the leader is unwilling or is not, or finds fault with individuals when they make a mistake, the environment will never be one that promotes it, that is understanding of it. If the leader makes the environment one that will support you when you make a mistake, then people will be more willing to take chances. And when they do make that mistake, it's okay. The reality is, everybody, is that I've been a nurse for 28 years. I have made so many mistakes along the way, and yet somebody thought I should have this job. And I got here because I made mistakes along the way, because I was acknowledged them, I asked for feedback, and then the next time I was in a situation, I changed it.
Now, thinking about your role as a leader and those skill sets that leaders should possess, you mentioned that ability to make a mistake, right, and to move forward and helping to create that environment and that culture. What are some of the other skill sets that you think are particularly important for a leader to be highly effective?
So you cannot underestimate the ability to employ emotional intelligence. And it's something that we don't talk a lot about, but I think as a leader, you can't just employ one style of leadership. You actually have to be able to individualize your style to the person that's in your office or that you're interacting with. Understanding where they're coming from. I'll give a good example. Is I had an individual who was designated by a former leader that you should fire them. They're not going to make it in this organization. And when I really spent time with this leader, two things that I know: people are a product of where they work and who they have worked for. And so you have to understand where they are, where they have come from, and what they have been through. And then work with them. If you make predeterminations about people, you won't be successful. When you're people are people. Everybody has a story in their life. People are dealing with different things. You have to be able to say, you know what, today I see that I noticed that, things aren't going okay for you right now. Is there something that you need? Is something going on? You have to be intuitive. But I think if you're just going to apply the same strategy to everybody, that will not make you a successful leader.
Yeah, so true, so true. Thank you. That's really, really helpful for our group. Now, we did have another question coming in that is kind of a follow-up. How do you increase emotional intelligence among your team when often we're told to leave emotions aside?
So I think, I believe that people can't leave their emotions. I think you have to make non-emotional decisions a lot of times. But people are emotional people. People are emotional. They're human beings. To think that they're not going to bring some emotion to work is not true. I will tell you that as a decision maker, I don't make emotional decisions. I look at factual things. I take the emotion into account, of course. When I've had to make very difficult decisions to reduce service lines that I know that are going to affect people's lives, for example, while I know that is going to affect them personally, I can't let that affect the fact that I have to make that really hard decision. you can be empathetic and still make the difficult decisions. But to ask people to sort of not be who they are is not effective. It doesn't happen. I've been a leader for a really long time. The person doesn't come to work as half of a person. They just don't. It's learning how to manage that emotional component and still making effective decisions. I had to have I had a very good friend who worked for me. She's worked for me for 28 years. And I had to let her go based on her performance. The emotional part of me was dying. She was my friend. She was at my home. I mean, this is, but I still couldn't let that affect, but I had to make a decision. But I could be empathetic about how I made it and how I carried it out.
No, that makes a lot of sense. We're emotional and rational beings, and to assume that we would be able to separate them fully is kind of a mistake in and of itself, I guess.
Correct.
Good.
Absolutely.
Well, now another thing that you talked about was communication and visibility. And you mentioned, in fact, that you filmed some behind the scenes videos of yourself that you were able to share out.
Mm-hmm.
And you have a mix of workers that are on site and some that are virtual.
Mm-hmm.
So what are some other things that you might recommend? Are there other strategies that you utilize to be visible to those both on site and virtual and to communicate, with effectiveness to both groups?
So the virtual folks was a little bit more challenging, honestly, but what we did was set up routine. Actually, we did routine town halls. I would do routine staff meetings with them to get them all in the same place virtually. I spent the majority of my time during this pandemic was being visible and communicating. I would come in on off shifts. I rounded. I was very rarely in my office. I actually had my nursing uniforms on. I went into all the clinical areas, met people, talked to people, sat with people, sat in the nurses' stations, went to find people in those hidden corners of the hospital that nobody ever goes to see. It was a lot of foot traffic. It was a lot of virtual meetings. But there's also, I think, a responsibility on the employee side where they have to engage in it as well. I think we had a lot of opportunities and we gave them a lot of opportunities. If they chose not to participate, that was a failure on their part. So communication is obviously bi-directional. I don't want to talk at people all the time. It was important that we made that information available. It was also important for them to participate with those different platforms. And to be honest, we were pretty successful. People wanted information. This was the one time I will have to say that people stopped what they were doing. They wanted to know what was happening. If I walked in a department, they knew I had something to talk about. They stopped what they were doing and came in. I actually would go nurse to nurse, person to person. I tried to see as many people as I could. I still do that today. We are still doing that today.
No, and you made such an important point earlier saying that when you think you've communicated enough, communicate more.
And considering that was one of the top opportunities that the staff said, we needed more communication. And I still think to myself, like, how could we have communicated differently? And now what we'll do with that information is we'll do focus groups and say, well, what ways did we not meet that expectation for you? To say, like, to actually give them an opportunity to tell us, what didn't we do that you felt we missed? Because if we don't get that information from them, then the survey really wasn't important.
No, this is great. Such great information that you're sharing today that will be so beneficial on a variety of levels. Now, as we're moving toward the end of our time together, what will you remember most from this period of time?
I will remember the fact that people came together in a way that they never had before. So UPMC Horizon and UPMC Jameson are two separate hospitals. So the two separate hospitals. What I remember and what I'm very proud of is that not one time when I asked somebody to go work at the alternate hospital did somebody say no. People stepped up to the plate in a way that they knew they must help their colleagues. The moment that I said, we have 50 nurses in quarantine, I did not have one nurse who did not say, I'll go do whatever you need to do. I did not have people in other roles say, you know what, I want everybody joined together. Everybody was afraid together. and everybody stuck together, more so than I have ever seen in all the years that I have been in leadership. I think that's the thing that I took away from this, and that people are actually pretty resilient. They actually really are. They will adapt. They might not like it at first. They didn't, but they did it. And now they have seen something on a broader scale, and that they made a difference in a way that they didn't realize that they could. So I think those are the two things that I'm most proud of, and the things that I really learned, that even now, just the status quo doesn't always have to be the status quo. But there are lots of ways to look at an issue, and the first answer might not be the one to go, let's look at all the alternatives and be creative. This is when we were really creative.
Well, and there are definitely some great takeaways from the way that you have handled this situation. You know, the visibility and communication piece. You know, more communication is often better and much needed. And being willing to make mistakes, as you said, you know, there's not always one right way to do something. And sometimes it takes some time to find out what's actually going to work, and relying on research. Really recognizing that emotional piece is important, but also making sure there's kind of a fact-based, logical-based basis for your decisions. So this has been so very helpful to us, and we can't thank you enough. So what I'd like to do, I'm sorry,
go ahead.
No, I was going to say I'd like to thank you, and if you have any final thoughts before I turn it back over to Sandy to wrap things up for us, I want to give you that opportunity.
Well, thanks. First of all, I want to thank you. I really enjoyed doing this. Certainly, if you have additional questions, you can always send them on to me. I'm happy to answer them. You know, I think on your leadership journey, and whatever point in it that you are, remember that we all didn't, you know, we learn as we go. I learned how to be a leader. I learned a lot of skills along the way. I also was very receptive to feedback that, you know, my leaders were giving me on how I was performing, not to take that personally, but to actually look at that as a gift. You know, coaching is caring. When you care about somebody, you will coach them, and if they care about you, they will coach you. And it's important to listen and really understand what are the things that you're doing well and what are the things that you can do better. Today, even though I've been doing this, every day there's something I could do differently or better, and I want to know about that. And that's, I think, an important takeaway.
Thank you so much. A great message for our audience. All right, let me reintroduce Sandy Mervosh to talk about our next sessions and wrap up today's program.
So, as Doreen thanked you, I want to thank you very much for joining us today, Marianna. It was really informative, great presentation. I learned a lot, and I'm sure that everyone that joined us today learned a lot, and we really appreciate, you set the bar very high. So we've got a lot to do to meet that caliber of presentations moving forward, so we thank you for that.
I appreciate it.
We are going to continue this. Win Wednesdays, we're going to do this, as Doreen said, twice a month. Usually is the first and third Wednesday of every month. So our next event is going to be on Wednesday, the 30th. And we're going to have Julie Annixter with us. So we're hoping that everyone will be able to join us for that event. And we will be sharing the link again through email blasts, social media. And you can always, of course, reach out and contact either Doreen or myself if you have questions about the Roland School of Business, and particularly about Women in Industry. As we said, our goal is to really accelerate women in industry by highlighting important topics that women can relate to, and also by highlighting very successful leaders that are women in industry, such as Marianna. So again, thank you very much for joining us. And if anyone has questions, please reach out.